Με την παρουσίαση.
Biologist. I have done PhD in the role of osteoarthritis and especially in microRNAs. So today we are going to explore the intriguing field of athlegenetics, focus on the relationship between genetics and athletic characteristics and musculoskeletal injuries and conditions. We all have experienced it. The classmate who excelled in sports, he stood for speed, endurance, coordination, and so many other sporting skills. And we all wondered, is it heredity? Is there really such a thing, sport genes? So in this presentation, we will address this very question and discuss how our genes influenced our sporting performance and our predisposition in musculoskeletal injuries and other conditions. So, in general, athletic performance is influenced by many factors. So, optimizing athletic performance requires a comprehensive understanding of athletics physiology, metabolism, and psychological well-being. So, utilizing the advancement in systems biology, researchers investigate how genetic variants, and especially single nucleotide polymorphisms, influence athletic phenotypic profiles. What is single nucleotide polymorphism? Is at a specific position in the DNA, SNP or single nucleotide polymorphism is caused by the replacement of one DNA base with another. Such variation can impact gene expression and consequently modify organism functions. So, we talk about athlegenetics. What is athlegenetics or sport genetics? Is an emerging field in sports science which explores the intricate interplay between genetic variation, phenotypic traits, predisposition to injuries, and athletic performance. According to many studies, SNPs can be associated with key athletic performance features such as endurance, strength, power, aerobic capacity, flexibility, psychological responses, injury predisposition, post-workout recovery needs, and other related factors. A characteristic example is alpha-actinin 3 gene, which is located on chromosome 11 and encodes for the alpha-actinin 3 protein, which is predominantly expressed in fast type 2 muscular fibers, contributing to the generation of explosive and powerful muscle contractions. What is happening with this gene? So there is a common variation in this gene. This gene variation involves, as you can see, a C to T transition in exon 16, resulting in the replacement of an arginine with a stop codon at amino acid 577. This variation causes complete loss of protein alpha-actinin 3 function. So you can see in the diagram their variant with the C base, which produces the normal protein, and the X variant with T base, which produces the loss of function protein. So, research studies have shown an overrepresentation of alpha-actinin 3 RR genotype in elite athletes when compared to control groups. Specifically, in Greek population, the frequency of the RR alpha-actinin 3 genotype is in power-oriented athletes versus the general population was almost 50% versus 25%. These results suggest an overall strong association between the presence of the RR genotype and elite power performance. In general, recent analysis on the literature suggests that more than 250 genetic markers exist with potential association with sport-related traits such as power, strength, and endurance. Also, there are certain genetic variations that may increase the risk of musculoskeletal injuries or disorders. So genetic testing is contributing to the early diagnosis of potential pathophysiological factors, and analyzing an athlete's genetic makeup and phenotypic trait. It is an approach that can offer insights into genetic predispositions for specific injuries and conditions. An example in this predisposition to musculoskeletal injuries is that individuals that carrying the T allele in a polymorphism of the collagen 5A1 gene appear to have a greater risk of injury of the Achilles tendon, anterior cruciate ligament, and tennis elbow injury. As many of you know, the collagen 5A1 gene encodes for the protein collagen alpha 1 5 chain, which is involved in the formation of connective tissue in the musculoskeletal system, and this explains the association between these polymorphisms and the greater risk of injury. Furthermore, specific genetic markers are associated with an increased susceptibility to musculoskeletal diseases like osteoarthritis. Osteoarthritis is a chronic joint condition with increasing prevalence worldwide. Currently, there is no cure for osteoarthritis or drugs, so clinical practice guidelines consistently recommend exercise as an effective first-line treatment for osteoarthritis. So the ultimate goal is achieving a precision medicine approach to osteoarthritis care, where tailored interventions are delivered to the right patients at the right time to improve outcomes. So genetics and the environment are two critical variables in this trial. So to this end, the perspective of developing polygenic scores on osteoarthritis progression and the response to exercise type can serve to tailor intervention for early osteoarthritis population or at-risk populations by identifying subjects with an increased propensity to benefit from a specific exercise combination. One potential physiological mechanism through which exercise may benefit osteoarthritis is mitigation of sarcopenia. Sarcopenia is the loss of muscle mass, which has already been linked to osteoarthritis. And in this schematic diagram, you can see the application of polygenic risk score in an early osteoarthritis population to guide prescription of specific exercise intervention to improve the outcomes. So, in this dynamic landscape of fitness, the integration of genetic testing is changing the way of personalized training programs. So now we start to talk about precision fitness, like precision medicine. So in precision fitness, personalized training programs are built based on genetic predispositions. There are companies that they use sport genetics testing for categories like endurance, strength, power, aerobic capacity, muscle hypertrophy, and in injury predisposition, pain tolerance, different injuries, musculoskeletal health, and post-workout recovery. So, sport genetic testing is suitable for elite performance athletes as well as recreational sports people, new or experienced exercise. A genetic analysis test serves as a valuable tool for recognized talents in sports, selecting the appropriate sport, maximize the fitness potential, and identifying the injury predisposition. All this knowledge can be translated into personalized training program for maximum performance and injury prevention. So So, in the end, the question is, how can experts benefit from sport genetic testing? So, genetic information, however, I can say that is not a substitute for intervention of an expert who should be able to guide accordingly. Coaching combines both experience and science. The coaching is using the best methodologies and individualizing them in order to maximize athletic performance. So in this developing field, we think that genetics can play an important role. How can athletes benefit from sport genetic testing? They can achieve, first of all, optimal athletic performance. This means that the combination of a favorable genetic profile with the appropriate personalized training and nutrition program can lead to optimal athletic performance. Also, we can improve athletic performance in areas where there is no favorable genetic profiles. How? Adapt training according to genetic profile in the fields of aerobic capacity, muscle strength, power, endurance, and body compositions. Also, as we discussed before, we can succeed the avoidance of injuries. Resilience to injuries and the ability to recover from an injury is a critical factor for an athlete's optimal performance. So genetic analysis of athletes serves as a tool for coaches in both prevention and injury recovery. So I would like to express my sincere thanks to the organizing committee that has invited us, also to the iDNA Laboratories scientific team, and to our academic collaborators. Thank you all.